So joining us now is Republican Congressman Jim Renacci. He's one of those undecideds. He's also currently running for governor of Ohio. Good morning, Congressman.
Good morning, Allison. How are you?
I'm well. At this hour, are you a yay or a nay?
I'm a yes, and again, my undecided position was really when the new amendment was added. I wanted to take a look at it, I wanted to vet it, I wanted to see how it worked with Ohio, what it did, and of course, after I was able to vet through it, remember, I was a supporter of the bill before this amendment, so the real key was to see anytime there's changes like this, I want to make sure that I understand it, and it's good for the state of Ohio.
So at this hour, you are a yes, you will vote for this new bill.
I will vote for this. Again, I was a supporter prior to this amendment. I am now a supporter after the amendment.
Let's talk about the amendment, because what the amendment, as I understand it, says, it's about, part of it is about pre-existing conditions. Let's talk about that, since that's the one that's getting a lot of attention. It's hard to know for people at home whether or not pre-existing conditions absolutely 100% will be covered. What's your understanding?
Well, pre-existing will be covered, pre-existing conditions. The real issue here is this amendment gives flexibility to the states. Let's face it, the difference between Ohio and California are massive differences, and this gives governors the opportunity to really develop their health care program, their Medicaid program, and some of the systems within the health care based on the state.
Agreed. So since it gives governors that latitude, how can you be so certain this morning that pre-existing conditions will be covered? What if governors say, no, I can't afford that, or I don't want to do that?
Well, first off, I look at it, it's best to push this down to the state levels anyway, and I believe governors know what's best for the state, just like mayors know what's best for the cities. The closer you get to the people, the better off you're going to be. So I am a big believer in allowing those decisions to be made at the state level. Yes,
but then how can you guarantee that pre-existing conditions will be in everyone's health care coverage?
Well, again, I support it. It's an issue that's already there. It's going to be up to the governors to make that decision. If the governors decide to remove that, then that's something they're going to have to do within the constraints of the people they represent.
I understand, but that's quite different from what you've said. If the governors decide to remove it, then that's their prerogative, but it leaves people then with pre-existing conditions not covered.
Well, I think the real answer here is how do we make health care more affordable? The system currently is not working. We've got to give some flexibility, and it allows the states to do it. Again, I'm a big believer in allowing the states to have this flexibility. That's what this amendment does. I would, as governor, I would make sure the pre-existing conditions were maintained and left in there at some point. But again, I think they're allowing flexibility. You can't have a one-size-fits-all, which is really the problem we have with health care today.
Yeah.
The Obamacare is collapsing because it's a one-size-fits-all.
Look, you say that's what you would do as governor, but there's no guarantee that the other 49 governors would do that. So what do you say to the American public for whom this is a really important condition?
Well, again, what I would tell the American public is we are voting a package that does allow to maintain pre-existing conditions. We're giving states flexibility. I think that's the real key. This is going back to the states where most people want it to be. Most people want decisions to be made as close as it can to them so that they have a voice in the decisions that are being made.
Yes, but I mean, look, not to belabor this, but it does mean that some people will lose their coverage.
Well, I don't believe that. I don't believe there's any governor out there that's going to try and eliminate coverage. I think what governors are going to do is design programs that best fit their states, make sure that it's designed for the people within the state. As I say, the difference between Ohio and California is major. So I like to see governors having the opportunity to really build a program that works, that brings costs down, and covers the people, which is what you're saying. We have to make sure that the coverage is there.
Have you talked to President Trump about your yes vote?
President Trump knows I support the plan. He knew that in the previous version, and he knows it now.
So what do you think is going to happen? Will there be a vote this week on this plan?
Well, again, that's up to the leadership if they're going to bring the vote to the table. I would hope that we can move this forward because it is important that we get health care past us, especially this part. We move it over to the Senate, let the Senate start doing their work on it. I'm a big process person. We are following the process if we can't keep this thing moving. So I hope we get it on the floor. I hope it passes and we move it forward. Remember, as I tell people back home, this is not the final bill. It'll go to the Senate. The Senate will change it, maybe eliminate provisions, maybe add provisions. They'll send it back. That's the process that really should work here.
One last thing, Congressman. There have been reports that this amendment and the new plan, that actually members of Congress like yourself would be exempted from any changes. Can you clarify that? Will you have exactly the same coverage as your constituents, or do members of Congress have a different plan?
Well, there's actually another piece of legislation that's bundled with this. If you take the amendment by itself, which some people are doing, it does exempt Congress. But the problem is there's another bill, which I co-sponsored with Martha McSally, which actually means that members of Congress are not exempt from this. So if you take the entirety of the bill, no, members of Congress will not be exempted.
Okay. Congressman Renacci, thank you very much for sharing your stance on this health care plan with us.